Just really seeing that need, that it's really difficult to serve patients' physical and emotional mental health needs when they don't have a roof over their head to heal safely.
Or they don't have an address to go to. So that's why they would come here. They can recuperate, they can take care of themselves, take care of their needs, then eventually hopefully go back to a space that is safe.
My name is Gargi Cooper. I'm a family nurse practitioner, and I am the team medical director for the Deborah Smith Walsh Recuperative Care Center. I formerly worked at Boston Healthcare for the Homeless, and there was an opportunity to build homeless programming in the city of Lynn. I was partnered with Patrick Bonville, our case manager, and within probably a month of being in Lynn, I realized how needed medical respite services were in the city.
My name is Ryan Griffin. I'm a psychiatric nurse practitioner at Lynn Community Health Center. I'm also the director of psychopharmacology. That means that I supervise the program of folks who primarily prescribe medications to patients. So while they're here, there are a variety of different services. People are seen by medical or nursing staff every day. That's just checking in on their medical condition and kind of following up with things. They generally meet with their case management team. It could be daily, but it may just be several times a week. And on Wednesdays, there's rounds. So that's when the whole team comes together to talk with a guest about what next steps are, start creating a discharge plan, and trying to wrap up the loose ends. This space is a partnership between Lynn Community Health Center and LifeBridge.
So LifeBridge provides the residential services, so the activities of daily living, the meals, coordinating the transportation, keeping people safe, physically safe in the building.
My name is Jason Etheridge, and I am the president of LifeBridge North Shore. And LifeBridge North Shore is an organization that is dedicated to serving homeless men and women in our community. And all of this is aimed at supporting the homeless, people at risk of being homeless, or even those who are recently housed. And what binds it all together is case management.
Getting people income, getting people hooked up onto housing lists and things like that.
It helps them get to where they have to be.
But we really work collaboratively because you not only have your health goals, but you have your social service goals and needs, which obviously is homelessness. And so that's a huge thing to tackle alone. And so when you have a partner that has resources and can also think out of the box and utilize them to support your patients, it's just super valuable and really important work.
And to have an organization like Lynn Community Health, to establish a recuperative care center, to serve some of the most vulnerable when they are the most vulnerable, whether it's post or pre-medical procedure, is amazing. LifeBridge, along with Lynn Community Health, has a pretty amazing responsibility, and it really is to demystify what homelessness is. So programs like the Recuperative Care Center are essential to the people we serve, and something we're very proud to be part of.
For medical staff, there is a full-time nurse, there is a medical assistant, and then there are nurse practitioners and physicians and physician assistants. We have care coordinators, community health workers, who help with some of the case management needs in the community. Besides working with the people who are staying at the respite, we also provide outreach services to local shelters or to people who do not have a permanent address. Besides that, there's myself. I'm a psychiatric nurse practitioner. There are two of us. There's a part-time clinical social worker therapist, and we've been trying to expand some of our services to include an art therapist, an acupuncturist, and hopefully even more.
We're really fortunate to have the specialty care that we do. We have behavioral health on site. It was really hard to get behavioral health access. So the fact that we have a social worker and two psychopharm clinicians, Ryan and Christine, it really helps with supporting people in their treatment. That's what makes our team very close-knit, because we are always sharing in these experiences, and they're pretty intense. But I feel really lucky that we have that really on site to help support our patients.
RP, he is now a 50-ish-year-old gentleman. I'll start with the happy ending, is that he is at a residence through Elliott Community Human Services for people with severe mental illness and severe medical needs. The beginning was that we started to see him at my brother's table clinic, and eventually it was quickly identified that he did have a severe and chronic mental illness that was impeding his ability to care for himself in the community. He was also a person who did not want to stay in the shelter because of his mental illness, because of some of the beliefs that he had about other people at the shelter. So what happened was one of the community health workers, Pat, was able to connect him with me, And we would actually drive around Lynn trying to find his cart. He had a very identifiable cart of his belongings, trying to find him at his local hangout spots. There were a lot of misses, there were a lot of not successful situations, but eventually we were able to find him. And over time, he began to recognize who we were and, was not that willing to talk for very long. But over time, he was able to kind of get himself in the shelter area, not staying overnight, and they were able to get him a room at a rooming house, which he did accept. While he was staying there, we were able to start him on some medications to help manage his condition. Fortunately, because his medical issues had gone untreated for so long, he ended up in the hospital with a stroke and heart failure. And it was a very critical situation for a period of several months. Eventually, he stabilized, and in that time, we were able to pursue an application for a Department of Mental Health. We were able to get him a guardian to help him make some of these financial and health decisions, and that's when he was able to make it into the program that he's at now.
When people enter into respite care, people are pretty nervous. They don't know what to expect. They don't know what our program rules are. They unfortunately have been pretty traumatized by our own healthcare system. So
medical respite care is for people who are too sick to navigate the shelter system, but not sick enough to need to be in the hospital or stay in the hospital.
You might see your face again. You might come through our doors again, and that's okay, because we're going to still welcome you with open arms and treat you with dignity and respect and say, hey, we're going to do this again. We're going to try again. And folks are really surprised at how our staff help them and are so nice and kind. And I think from there, you can actually see as people stay at respite how their lives honestly transform. They start to trust us more. They start working on their own goals, and they might not meet all of the goals that we want them to meet, but that's okay because our mission is to just meet people where they are in their own health journey. So we want to make sure that they're okay with whatever test they're getting or whatever information they might unveil now if they engage with the medical system, because it can be really scary. It's really amazing to be able to witness the healing of folks and how their lives kind of transform, whether they re-engage with a family member or their diabetes improves greatly. And hey, guess what? They actually feel better. And working with collaborating partner agencies like the Lynn Health Task Force, My Brother's Table, Full Hospital, North Shore Medical Center, Mass Coalition for the Homeless, and obviously Lynn Community Health Center, with all of their support, is really what makes the respite a really special place and allows people to relax and heal.
Yeah.